mistake, but I just thought I'd point that out. The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, let me assure this House that our government is firmly committed to actively defending our publicly funded healthcare system. Like all Canadians, we share the strong belief that all individuals deserve access to timely, quality health care, regardless of their background, physical need, where they live, or how much they make. This is part of what defines us as a nation. Our government has shown time and again that we stand behind the core Canadian values of equity and solidarity. These are the very values that underpin the Canada Health Act. This is why we will continue to work collaboratively with our provincial and territorial colleagues to ensure that citizens across the country can readily access and defend on our cherished healthcare system. Publicly funded healthcare in Canada is based on 5 principles contained in the Canada Health Act. These principles include comprehensiveness of insured health services, universalities of population covered, reasonable access to insured services without the impediments of user charges, portability of health benefits, and public, non-profit administration of health insurance plans. Canadians believe in the equality of citizens, and our healthcare system reflects that fundamental belief. For this reason, Canadians are proud of our publicly funded healthcare system. In fact, a Stats Canada report on Canadian identity published in October 2015 found that almost 80% of Canadians have pride in the Canadian healthcare system. The federal government wants to ensure Canadians continue to have this strong sense of pride, and accordingly, we're committed to working closely and collaboratively with our provincial and territorial counterparts to realize the aims of Canada Health Act. The Canada Health Act is clear. Under the Act, provincial and territorial health insurance plans are required to cover medical necessary hospital and physician services. Any charges to patients for these publicly insured services are considered extra billing or user charges and are prohibited under the Act. Ultimately, these fees create barriers to accessing health care, and our government would like to see such fees eliminated. When Canadians elected our government, they chose a government that promised to focus on a new and more collaborative relationship with provinces and territories. Therefore, our government's approach to the administration of the Canada Health Act will emphasize transparency, consultation, and dialogue with our provincial and territorial healthcare ministers to resolve potential issues. The Minister of Health has made it very clear that she upholds the principles of Canada Health Act. This is why the Federal Minister of Health recently wrote to the Quebec Health Minister underscoring her commitment to publicly funded healthcare system without charges to patients for insured services. She asked that his financial statements of extra billing and user charges for 2014-2015 due to the Health Canada this December reflected information on these charges as documented by the Quebec Auditor General's report this May. It is important to remember that the ultimate goal of enforcement is not to levy penalties, but to ensure compliance with the principles of Canada Health Act so that Canadians have access to the health care that they need when they need it. I'm pleased that the Quebec Health Minister of Health recently announced concrete actions toward removing barriers to access by eliminating fees charged by patients for insured services at a point of delivery. Let me conclude by confirming that our government believes that any trend towards privatization resulting in a move towards a two-tiered system undermines the fundamental principles of Canada Health Act and would be deemed a threat to our publicly funded healthcare system. As such, our government will continue to defend the principles of Canada Health Act. Thank you, Mr. Speaker.